Good morning, everyone. As Nikki said, my name is Candace Boutel. I'm also with Inspire Sheboygan County. We're really glad that you could join us for our virtual career events featuring our healthcare career pharmacy technician. And again, thank you to the sponsors, the NEW Northeast Wisconsin AHEC group and the Milwaukee AHEC group. And today we have a special guest. Her name is Miranda Wagner. And Miranda, if you would start out just by telling us about your journey, tell us what led you to be in the position that you're in now, maybe any educational pathway you might have taken. I think we had talked about maybe taking a look around. So go ahead and tell us a little bit about yourself.
Hi guys, my name is Miranda. I work at Aurora, Two Rivers. It's in Manitowoc County. I've been a tech for 4 years now. I started off going to UW Manitowoc, not really knowing what I wanted to do. I was kind of up in the air. I worked as a waitress at the time, and one of my customers was a pharmacy technician for CVS, and I decided, well, I'm going to try to job shadow. So I job shadowed her, and I actually was super interested in the retail part at first. I then went to LTC, where I got a degree in pharmacy technician, and then I went farther and I got my pharmacy technician management certificate also. So that was about 1.5 years because I already had my gen eds done. I then came to Aurora to do my clinicals, where I actually got offered a job while doing my clinicals. And I was like, I really like hospital. It was so much different than retail. I loved retail too, but hospital is definitely more fast paced and a lot more different options to do. Both of them are super fun though. Both of them are completely different though. So now I'm still here. Started off as a Tech 1. I moved up to a Tech 2. Then I moved up to a tech specialist, and now I'm actually going to be the lead tech. So there's lots of room for advancement if pharmacy technician is something that you're interested in. I currently am married, been with my husband for almost 10 years now. Makes me feel old. I have a dog, 2 cats, and I just had a baby. Well, she'll be 1 year next month. So that's where I am in life right now.
That's a busy life right there. Congratulations on your new little one. That's fantastic.
Thank you.
Well, you gave us a ton of great information there, and I know a couple of questions have already popped up based on that. So why don't you start by telling us, maybe detailing a little bit about the difference in a hospital setting versus a retail pharmacy setting?
So retail, I only worked in retail for a little shy of 1 year. It's a lot more patient interaction. You deal with insurance companies a lot, and you do more of counting meds, sorting meds, and inventory type things. Where now hospital, here at Aurora, we have different job settings, I should say, every week. So 1 week we do it, you're in the IV room where you make all of your IV medications, fluids, drips, injections, all that stuff. We also have to do what's called batch fill every day, and that is where we pull a bunch of medications to refill the Pyxis machines that the nurses pull their medications from. So we have to do that every single day so that the nurses don't run out of meds for the patients. We also have to do inventory. A lot of it is inventory, a lot of counting, making sure we have enough stuff to get us through a week, a weekend. We do something called medication histories, where if a patient gets admitted, we used to go into the room, but now with COVID, we do it over the phone. So you have to call them and go over all of the medications that they took previously before coming into the hospital. So we have to go through that with them also. Those are like the main stick out points of retail versus pharmacy and hospital.
That is super informative. And so what I envision then, I think maybe a lot of us that when we think about pharmacy, we're thinking of that retail side because that's really what most of us have interacted with. So This might be a good time. If you're able, do you want to kind of show us around any little portion that you can right where you're at?
Yeah, so this is actually just my boss's office right now. We're just in her little office. I can show you the rest of the pharmacy. My boss is being so grateful and taking the camera for me.
Oh, perfect. She is the camera person.
So this is where we keep all of our medications. These are every bin has a different medication in them. These are just our tablets over here. And if you kind of just sneak over here, this is all of our injections all over here.
So the question, when you're pulling those, you're using the tablets, are they doing some scanning, things like that?
Yes.
Okay.
So we have a machine that tells us, we have a computer that tells us what drug they need, and you go to the bin where it's in. So everything is in alphabetical order. So you go to the bin that it's in, you pull it, and there's a little barcode. There's little barcodes on the bins.
Okay.
Little tiny ones. They're really small in this camera. And you scan that to make sure you're getting the right drug. Then you compare it into the computer that the drug is telling you to pull. So this is our IV room. This is the ante room where you get all gowned up and ready to go. This line right here, green side is the dirty side. So anyone can walk on this side and you do not have to be gowned. But once you cross over to this side, you have to have a face mask on, a hairnet on, a gown on, and booties on.
And take off all your makeup and jewelry.
Yes, and no makeup, no jewelry, no fake nails, no nail polish, nothing.
Very strict dress code.
This room, if you can kind of see in there, is our daily hood for the technicians. This is where we make all of our stuff in. And then if you can kind of see this one, this next door over here, that's our hazardous drug room. That is where we make all of our chemo and our hazardous meth. Big machine right here is our C2 safe. So this has all of our narcotics in it, from C2 to 5. And then this is our back room where we just have our filing cabinet, our fridge, and our freezer. So that's where all their medications are stored. Then we have our incubators over here, which is for surface sampling and all your media fills and stuff. So every month you have to surface sample your IV room to see if you are growing anything or having any contamination, because you want it to be as clean as possible, because the things that we're making are going into people's bodies. So you want it all to be super clean.
This is really fascinating. We have a student, or one of our guests, Abby, says, I'm currently a pharmacy tech. Hospital pharmacy seems much more interesting. It is very interesting.
It is completely different. And that's our pharmacy. We are one of the smallest sites at Aurora, so we're not super huge. We don't have a huge room.
So Abby also asked then, because she probably has a better understanding maybe than some of us, she says, do you file your controls differently, or are they all filed the same way? Can you elaborate on what she's talking about?
They are filed differently. We have one spot for just narcotics. We have one spot just for C2s, and then one spot just for 3 through 5. So you have to keep them for 7 years. We file them every year in a box. We seal the box, we put it down in the basement, and we mark them. You have to keep them for 7 years, but everything, yes, is separate. We do not keep our 2s with our 3 through 5s, and we don't keep it with our other paperwork.
So the other piece that might be different too is we don't have prescriptions in hospital.
Yep.
We work off of orders. It's going to look slightly differently when it comes to our controlled substances. We don't have prescriptions that come in like you do in a retail facility. Ours just moves from the great big Pyxis machine you saw in here to a Pyxis machine on the floor, which is kind of like an ATM for nursing. So we're tracking that movement versus actually having a prescription come in for a specific patient.
Here's another question. Josh asks, is the pay different in private pharmacy and hospital pharmacy?
So private pharmacy and hospital pharmacy might be pretty close.
Okay.
Retail pharmacy and hospital pharmacy are different.
Thank you for that distinction. Yeah. Because Annie was asking then, just before Josh asked that, how is hospital pharmacy different from private business farm? Again, if there's some of us that aren't familiar with that, can you describe the difference between those two entities?
I've never had to deal with a private pharmacy. So I actually am not even sure how that would work either. Do you have any? Nope, my boss doesn't have any insight on that either. We've both never had to do any private pharmacy, so I wouldn't even know ballpark what to tell you on that one.
Sure. No, thank you. And we'll get this question out of the way, because it's one certainly anyone looking at a career is always curious about. Do you know what like an entry level wage or salary would be, and then maybe like an average salary? And if you want to make the distinction between the hospital versus the retail, or you can go right ahead and explain that.
Yeah, so every organization has their own way of paying. So each health system is slightly different. So what I tell you is going to be slightly specific to Advocate Aurora Health. So the way we do it, we have a calculation that comes in. So depending on if, like in Miranda's case, she had her education already, so she would start higher than somebody that did not have an education. If you are already certified, which Miranda is, you would start higher. If you have a 4-year degree, but it's not in pharmacy, again, it's all based on that type of thing. So typically our pay range is anywhere for a Tech 1 is about $13.50, maybe $14 to about $17 or $18. And then obviously you move up from there. So Miranda's obviously, since she's progressed with me over the last 4 years, she's on a higher pay scale than what she was on when she first started. I have not worked retail for a very, very long time, so I couldn't really give you a good ballpark on pay, but
it is typically, at least when I went 4 years ago, it is typically minimum wage of what the state of Wisconsin is. So I don't know what the minimum wage is right now, but that is typically what you start off, maybe $1 more, but that's pushing it.
And again, it depends on the organization that you work for. You know, a CVS, Walmart, Walgreens might be different than like a more mom and pop, like the medicine shop here in Two Rivers, or even retail side with the Aurora as well. So it's slightly different.
Awesome. That's super helpful. And that actually leads me into some of our other questions. Students and teachers, whoever's watching right now, you're doing a great job of being engaged and asking tons of great questions. Let's go back to the idea of the educational pathway that leads to this. So you had mentioned you did the pharmacy tech program and the pharmacy tech management, and you said 1.5 years. Was that total for both of those, or was that just the management piece?
That was total for both.
Okay.
But I did go to UW Manitowoc for 2 years and got my gen eds. So
Sure.
Typically you would have added another semester, so it would have been 2 years.
Okay.
I saw some of the things pop up. You do not need schooling as of right now to get the job. It's always just a better thing because you have more knowledge, more insight. You're not going in blind.
I would say that's probably the hardest struggle is I will hire somebody if they've got a good personality, always benefit if they've got some sort of pharmacy background. What Miranda and I are showing you and sharing with you is just the tip of the iceberg of what we do. A lot of people come in not knowing exactly what pharmacy is, and they find out it's a lot harder than what they anticipated. So we do recommend schooling or having some sort of experience to come in here, just because that way you come in with a little bit better idea what to expect, and you're not so blindsided by how difficult at times this job can be.
And then we were talking about those different levels, and that might, I imagine, vary between different organizations. But can you tell us some of the responsibilities between, you know, the Tech 1, the Tech 2, and then when you go into a lead technician?
My expectations for a Tech 1 is doing their everyday job, come in, do their job, and they do it well. All the activities that Miranda said a Tech 1 would be responsible for. The difference between a Tech 1 and a Tech 2 is their involvement as a leader. So they have to be an informal leader, which Miranda has obviously done. Being on a system group, running, being a point person for something here in the pharmacy. So for example, Miranda is in charge of our IV room. I have another technician that's in charge of inventory and purchasing. And then I have a third technician that wants to become a Tech 2. She's currently a Tech 1. She's going to manage all of our controlled substances and making sure we're regulated correctly with that. And then the lead that Miranda is training to be, because she'll be our lead come January, she is now, but she'll be our full lead in January, is more of being my right-hand person. So obviously I can't be here 24/7, so I need somebody here that will be able to troubleshoot and manage operations. I have a pharmacist that takes care of the clinical side of things, which a technician cannot do, but the lead technician typically takes care of when the IV room breaks, what happens? When this break, what happens? We run out of a drug, what happens? Managing those things when I'm not available.
That is excellent. So it really sounds like it's not necessarily just the technical skills. It sounds like an educational background will definitely help you, but it's all these skills, students, that we talk about with each of our sessions, those employability skills and proving yourself and taking initiative, and then really being able to work your way up into those new ranks. That's wonderful. Well, students are really wondering, what is a day in the life like? So you kind of were showing us all the different rooms. Maybe describe, Miranda, if you want to describe what your day is, and honestly, Abby, if you want to share at some point too, as a management role, that's a great perspective to see from both of you.
So depending on the week, so like this week, I am the IV room person. I start my day off by coming in. So we are not open 24 hours. We have a 7 to 3:30 in our main pharmacy. And then we have an after hours pharmacy that goes from 3:30 till 10. So from 10 till 7, there is not a pharmacy technician here or a pharmacist. We do it remotely. Someone remotely helps us. So when I come in the morning, I check to see if there is any drips that need to be made, any insulins, anything for surgery. So we make a lot of, like surgical stuff, like syringes that they need, like antibiotics and stuff like that. So I check to see if there's anything that came through that's going to be either due around that time or soon. because we get there at 7. Sometimes if it's due for 6, the nurses will wait until we get there so they don't have to make it. So like today, walk in and I get hit with, we have 3 new patients on remdesivir. So those are COVID patients, and we needed it right away. So right when I walked in, I'm like, oh, okay, we're gonna start the day off right away in the IV room. We do batching. So we make, like I said, syringes. We can batch those and freeze them. So we make about 150 of them at a time. That lasts us roughly a week to 2 weeks, depending on how high our surgery schedule is. Today, I made some pain pumps this morning for surgeries tomorrow. And then I make Vancos, and those are also antibiotics for patients.
I would say our volume is significantly smaller than if you go to like Baycare or Sheboygan. Our 150 syringes would last like a day at Green Bay. Just keep in mind, when we are talking about small town hospitals. There are facilities that are significantly larger than us that are 24/7. Techs have to be there 24/7 along with pharmacists. And the volume of what they do is a lot more, and they typically specialize a lot more than what you see at a small facility. One difference between a large hospital, small hospital, large hospitals typically, like when you're an IV room tech, that is all you do. Where with my staff, we're an N of 4 technicians, so everybody's got to be able to do everything, including my pharmacist.
We do it all.
Yep, so that's kind of the trade-off is we don't specialize as much, but we have to be a jack of all trades.
That's really interesting. To specialize then, does that take extra education? Does it just take some on-the-job training?
Nope. So I am considered the IV room specialist. And to get to that point, it was just being like super engaged in basically taking control of it. So I was always making sure the surface sampling was getting done and the monthly clean was getting done. And if something was happening in there, I would troubleshoot. Why is this happening? What can we do to fix it? Why is it happening? What's going on? I helped a lot of other people with a lot of other things. So I was also part of USP 797, and I helped build a website that we used to track the IV room. And I did certain things that helped me get to that point of wanting to be the IV room specialist.
The other really cool thing that's different with hospital pharmacy, and when we talk about specialized roles, is there's things outside of these 4 walls here. So we have something called an automation team, all remote technicians, and it is all technician driven. So what they do is they are in charge of all of our equipment that you saw. So like our Pyxis equipment, they're in charge of that. They're considered the experts of that. Our automation that's in the main pharmacy that Miranda was talking about with scanning, they're in charge of that. They're in charge of making sure that that equipment talks to our electronic medical record. So they do a lot of that type of stuff. So they specialize in everything that does our perpetual inventory, all that type of stuff. So there's jobs outside of just our 4 walls that are needed for a hospital pharmacy as well.
Absolutely. And Abby, do you want to highlight anything more about your day today that obviously would look different than Miranda's?
Yeah, so I didn't introduce myself. My name is Abby VanHuizen. I'm the Director of Pharmacy and Respiratory Therapy here. So I am a pharmacist. I have to be a pharmacist to have this position. I've been here for about 6 years. I apparently do my job well. So about 2 years ago, they gave me respiratory on top of pharmacy. So when I come in, I typically check on my respiratory team as well as my pharmacy team, so I can make sure respiratory is here 24/7. So I got to make sure I check it on my night shift. Everything's going good. And then I come in, check on here. I call into multiple meetings throughout the day. Sometimes my team doesn't even see me because my door's shut all day long. I'm in charge of all operations within the main pharmacy. I don't do a whole lot of clinical stuff anymore. I am truly more operations. So we have new automation going live. I'm the one that's in charge of making sure nursing's educated, my team's educated, and then when we go live, troubleshooting any issues, that kind of stuff, and connecting the type of person. So a lot more of my job is project management. I also obviously take care of discipline and personnel issues. It's very different than a clinical pharmacist or a technician.
Certainly, yeah. And so that makes me wonder, who else is on your team then? We have the pharmacy techs, you're acting in a management role, but you were talking about other pharmacists. Who else sort of rounds out your team?
So I have 1.5 pharmacists on my team as well. So we have, again, Miranda said, our pharmacists are only here from 7 to 3:30, and then it's all remote. So we have multiple departments throughout our system. We are a 28 hospital system now.
Yeah, now with Advocate.
And so we have a remote verification department made up of fully pharmacists that do that type of stuff. And then one of our sister hospitals, Grafton, takes care of us at night.
Excellent. Well, to move on a little bit, a lot of students are wondering what do you love about your job? What keeps you going each day? And then also, what are the challenges of your job?
My favorite thing is when you know what you're doing in giving a patient is making that patient get to go home. That's always the rewarding part. Like, you know, you're making something to make this patient feel better. That is always a great feeling. I'm a people person. I love the nurses. I love the staff. I love everything. I love all of that. So I love being able to communicate. You don't just deal with pharmacy. So I have to communicate with respiratory and the nurses and EVS, and you have to communicate with everyone. And I really love that part of it too, where as retail, you do have a lot more patients than you do here because you see them. Here, you don't actually get to see them. So that was always a struggle for me. The hard part of the job, I would have to say, because we're so small, there's 3 full-time techs during the day. There's always typically 2 off during the week because you work weekends, so that gets hard. But I would say time management, because if you're busy, there is a lot to do in a day, and you need to know how to schedule out your time. It's not the end of the world. And if you don't get something done, it's okay. But that is definitely the hard part, is when we are busy, because we're so small, we only have us 3 to get through it.
I think one of the challenges we see with our second shift position, which, by the way, guys, I am hiring. I have an open position.
We're hiring.
FYI. Our second shift position, probably one of the most challenging positions we have in this department. That's because we have to have somebody that can work independently. They do not have a pharmacist at their elbow like they do during the day. There are positions both inpatient and in retail where a technician works independently. A pharmacist oversees them remotely. So you need to have somebody that has strong time management, is able to troubleshoot and be able to function on their own. And that is a very hard skill to hone in a technician. So
very good communication there.
Yes. So typically I have to have some of the better technicians on night shift because it is a very difficult position.
Definitely. And we have featured a few different healthcare careers. And for instance, nursing is one. They often say the flexibility of it is so great because there's just such a variety of things you can do with that nursing career. What is the flexibility like in your roles? Is it really a more established, hours and days? It kind of sounds like that might be the case.
Yep. So we are 7 to 3:30. So day shift is 7 to 3:30, and then you work every 3rd weekend, which is also 7 to 3:30. And then second shift is 1:30 to 10, and that you also work every 3rd weekend. When you work your weekend, you have a day off before your weekend and a day off after your weekend.
And typically that's the case across the board. I did come from a larger hospital pharmacy. The schedules are a lot more set than they are with nursing, depending on what your role is, whether you're full-time, part-time, whatever the case may be. You might just work the weekends. If you're at a larger facility, you might work just during the week, which is not very common, but it can happen. Typically it's every 2nd to 3rd weekend is what you have to work, and it's normally every 3rd to 4th holiday you have to work.
We had a few technical questions here. Maddie was asking, do you make suspensions? If you do, how many do you make daily? I don't know if you had addressed that already. No.
We do not. Nope. We are not a compounding pharmacy.
Nope.
Gotcha. And, okay, which Abby was asking, do you guys make capsules and compounds as well? I'm guessing that's also a no.
Yep. So we do have one of our Aurora Pharmacy Inc. locations. That is our retail version of like Walgreens, Walmart. That is a compounding pharmacy. Compounding pharmacies are under different regulations, and they are the people, if we need something like that, they're the ones that compound it, not us.
I see. I know what I was going to ask before. It was, is there a high demand for this job? If students are going into this field, are they going to be able to find a job as we made the...
Oh, we are dying for technicians.
Technicians, yes.
Pharmacists, not so much.
Yeah, okay.
I strongly recommend technician is a great career. We are always begging for technicians. Miranda's program, we are still in contact with. They barely have 1 to 2 students per year. Phenomenal career. You get to be around patients without having to touch them, which, sometimes people get a little leery about touching patients. And you get to make a big difference in a patient. And I would argue some of the pieces that we do are just as challenging as, you would see with a nurse or something like that. The IV room is very complicated. So it's a very rewarding career. There's lots of things you can do with it. We are always, I think out of all of the North Market hospitals, every single one of us have an opening.
That is great to know. And then I'm hearing that it really is a career. And I think Josh was alluding to that in his question, is this a life-sustaining role?
I have been here the least amount of time. So I have been here, it'll be 4 years. The other 2 techs that work here that are also on day shift, one has been here for over 20 and the other is 15.
Sandy's been here 25. She's actually retiring
Yep.
at the end of the year. Hence why Miranda is going to be our new lead and why I have an opening.
Starting off, I feel like I was like, is this a lifelong thing? You know, is this something I can do forever? And then when I think when you find out that you can advance in the career ladder and move up, and you have so many other options, you're like, yes, it is definitely something you can do for the rest of your life.
That is excellent. Thank you for that. And students, we're going to be wrapping up here pretty soon. So if there's any other questions you really, really want answered, you can put those in the chat and we can definitely try to make sure we get to those. How has, your role or even the field that you're working in, what tools and resources have changed or are new? Is there a lot of advancing technology?
Everything. No, everything. Everything changes like every month, I swear it.
So since I have been here in the last 6 years, I don't think we've had a quote unquote slow year. So we got new Pyxis equipment. That was a very big ordeal. We went under construction. So Miranda alluded to USP 797 and 800. That is regulations that are around specifically the IV room. There was a great event in New England where patients died because of pharmacies' lack of attention to detail with compounding. So that's where there's this great big push for these regulations. So we had to gut our IV room and go through that. And unfortunately, we've had to gut it more than once. We are the experts of downtime with our IV room.
Literally.
Yeah, we've swapped out our automation in the main pharmacy at least once, but there's been multiple other changes. It's not even just that. It's, we got new flooring, we got new countertops, and figuring out how to work around that. So it's ever changing. We merged 2 years ago with our Illinois partners, Advocate. So that's why I keep saying Advocate Aurora Health, because that's what we are. So since then, we've had multiple formulary changes. We've had other platform changes. It's constant change. So it's never boring around here, even though we are small.
It is always change. Whether even if it's just something small, like something so small, like a medication, the name, they're like, oh, we use brand. Well, now we're using generic, or a strength. Like we have 10 milligrams on the shelf. Well, we don't want 10s anymore. Now we want 20s. It is always changing.
What are the benefits of this job? I think you kind of alluded to that as to what your favorite things are. I'm not sure if he means as far as like additional benefits to your wages, but you can answer that question as you see it. What are the benefits of the job?
Well, if we're talking like actual benefits, so we do get like full-time health. If you're full-time, you can do health insurance. We have an FSA where you can put money in and they match you.
I mean, you have all the type of benefits that you do anywhere else. I mean, you have PTO, you have retirement, you have everything like that. In terms of a benefit of the job, it's a very self-satisfying job because you do impact patients. The part that I enjoy most about my job, I don't really deal with patients terribly much anymore because I moved into this role. I do a lot of project management and I really like that. And Miranda does a lot of project management as well. And that's very rewarding to see something that you worked on go live and knowing that it's better for the department, better for the system.
Definitely seeing something that you've worked really hard on and then it actually working and you're like, oh yes, it feels great.
One of the things I also enjoy, part of my job, I get to travel to a lot of the other facilities. So I've been in all the different Wisconsin hospitals and I've been in 2 or 3 of the Illinois hospitals. So I get to see the various sizes of the hospitals, how their operations work, get to go, oh, hey, this would be really cool for us, or hey, this is working great for us, why don't you try this? So there's a lot of collaboration, which is awesome as well.
Yep, I've gotten to do that too. I got to travel for a while and it is nice seeing how other people do things because it is, some sites are completely different than us.
Mm-hmm. Sure. Then you can really establish some best practices and figure out what works for you.
Yep.
Miranda, it looks like this question is more specific for you. What inspired you to become a pharmacy tech?
So I knew I wanted to do something in like the health. Okay, my original plan was a vet tech, but listen, I just cannot because I'm way too emotional for that. I knew that wasn't going to work out for me, even though I was really sad about it. And then I knew I wanted to do something in healthcare. Well, I don't do puke. I don't do blood. I can't do that. You'll see me on the ground too, and then you're going to have to help me if I have to help you.
Hence why I said this is a great job if you don't want to touch people.
Yeah, that part wasn't for me. So I'm like, all right, well, I can't be a nurse and I can't do this. And I honestly didn't even think about a pharmacy technician. That wasn't even in my mindset. I didn't even honestly know that it was really a thing. I mean, I knew people worked at retail pharmacies, but I never thought that would be for me. And then I did do that job shadow at CVS Pharmacy. And I really liked how everyone was so nice and comforting and how everyone takes their job so seriously in pharmacy that I think that really opened my eyes. And Like I said, I went to LTC and I decided to take the course because I'm like, this will help me in the long run if I do have some educational background. I ended up doing my clinicals here, and so I had a little bit of retail experience, and then I had a little bit of hospital, and I did work at the retail position when I did my clinicals here, and I ended up leaving my retail position to move to hospital. So it was really, like I said, I wanted healthcare, and I don't think people, like you said, I don't think people associate pharmacy technicians with hospitals. They associate with retail. You don't see us in a hospital setting, and I think that makes people kind of not realize we're here. They don't know about the job because they think it's a retail position.
Sure.
So I did see a question pop up about job shadowing. Unfortunately, with COVID, we don't allow that right now. We used to, but until the pandemic is over, I don't foresee that happening again, which is a shame because that's typically part of the job interview process. But if you do, we do allow students. So if you are interested and become a tech student, we allow them for clinicals, but we just right now, for the safety of us and for you and for our patients, we can't allow you in for a job shadow, unfortunately.
Yeah, absolutely. That makes a lot of sense. And I was just going to say, it's so helpful to hear about these less with the direct patient care careers, because there are so many careers in healthcare that really aren't that direct patient care. It's a little bit more behind the scenes, but this has really given us a great look at that today. So let's wrap up with, if a student was thinking about going into this, it's going to be a two-part question. What could they do to prepare themselves, perhaps while they're still in high school? And then how might they know that it's, the right fit for them?
So I don't think I mentioned this in the beginning. In the state of Wisconsin, it is not mandatory to have you have to get certified. In the state of Wisconsin, that is not a thing. I feel like in the future it will be. For Advocate Aurora, it is a thing. You have to be certified within 1 year of your hire date. Other places are not like that. You do not have to be certified, but I think that will change eventually. So I just wanted to throw that in there because for Advocate Aurora, you do. Some other places are making it mandatory, but the state of Wisconsin, as of right now, you do not.
And can I just quickly ask, does that mean you're going through that program at like LTC to get that certification?
No.
Or how do you get the certification?
So we have our own version of Pharmacy Tech University that we help people through. I've had one team member go through it. In terms of preparing, the biggest thing I can tell you is to go out and get a job. When I was a senior in high school, I was debating whether to go into pharmacy. So I worked as a pharmacy tech at my local grocery store. And then I worked pharmacy through my entire college career. That's probably the best thing I can tell you to do is to go out and get some experience. Like I said, a lot of us, because we're in so desperate need, if you've got a great personality and you get along with people, we can teach you everything else. It's the hardest part is making sure you have the right personality to fit in with us. So just don't be afraid that you don't have experience. We're all willing to hire if you have the right personality.
If you are really interested, I would recommend going to school and taking the course. Pharmacy technician certificate is only 1 year. It's very informative, and I think that would make up your mind on whether you would want to even work in pharmacy or not, because you learn so much. There is a hands-on class that you get to do, like work with needles and stuff, because that's always people's fear. When I first started, I was terrified of the IV room. And now that's all I do. That's all I want to do. But if you are interested in pharmacy technician, I highly recommend taking the course. So for us at Advocate Aurora, if you take the course outside of work, you don't have to take it here. So if you already have the education background, you don't have to do it here. Yep. And then, like I said, you have to get certified, and it's an exam.
And the schooling does help significantly pass the exam. The exam it's not like you just show up and take it. It takes quite a bit of studying to pass.
Yes.
Well, you have given us so much information to think about, and we've learned a lot about these positions in both the hospital pharmacy and just as a pharmacy tech in general. Students, I've posted a link to a survey that we would really appreciate it if you could give us some feedback on how the session went today. And Abby and Miranda, thank you both so much for your time today. We really appreciate it. It sounds like it's a busy place, so we really appreciate you taking the time to speak with us today.
Thank you.
Thanks.
Thank you very much.